The next bill has not been heard in subcommittee, and it's Delegate LaRocks' bill, HB 2242. Is the delegate with us tonight?
I am, Mr. Chairman. Can you hear me?
Well, yes. Well, welcome. Welcome. Why don't you tell us about your bill and the problem you're trying to solve?
Thank you, Mr. Chairman, members of the committee. In the simplest terms, this bill seeks to afford protection for persons in the Commonwealth from retaliatory action for refusal to receive one and only one vaccination. That is the rushed experimental COVID-19 vaccination. I'll explain why I would seek to apply this just to a COVID-19 vaccination. The COVID-19 vaccine and how it came into existence is unique. The COVID-19 vaccine falls under the Warp Speed program and the national emergency declaration by former President Trump. COVID-19 vaccinations have been granted emergency use authorization. That is for any and all COVID-19 vaccines. An emergency use authorization gives the FDA power to authorize unapproved medical products and unapproved uses. With this provision, complete immunity is extended to companies that make products and devices. Stated in simpler terms, the vaccine is not FDA approved. That means that the general public is left to assume any and all risks from the products, devices, biological components of the vaccine, unless a harmed party can demonstrate willful misconduct. Emergency use authorization provides for an expedited approval process for vaccines and eliminates the requirements for long-term study. It's crucial to understand that COVID-19 vaccines have not been extensively tested on elderly persons, young children, pregnant women, individuals with autoimmune conditions, medically fragile persons, minority populations, and those who take medications that may or may not interact synergistically with the vaccine. Mandating the COVID vaccine that may cause known or unknown chronic adverse reactions. It raises serious ethical and moral and philosophical concerns. This bill seeks to avoid adding to the immense burden of people who are already enduring the burdens that they are already enduring in this age of the COVID virus. I hope you'll agree that it is wrong to place people in the Commonwealth in the horrible position of having to choose between A, taking an experimental vaccine, which is potentially dangerous in a situation that manufacturers are shielded from liability, or B, being punished. Mr. Chairman, I'll close by directing the committee to lines 947 and 952, which basically capture the essence of what the bill is seeking to accomplish. And I'll read them. Notwithstanding any other provision of the law, no person shall be required to receive any immunization against COVID-19, and no person, because of his vaccination status, shall be discriminated against with regard to the provision of any disposition, service, financial benefit, eligibility, admission, enrollment, participation, membership, or other benefit, subjected to segregation or separate treatment, restricted in any way in the enjoyment of any advantage or privilege enjoyed by any person receiving any disposition, service, financial benefit, or other benefit. So, Mr. Chairman, I'll close by saying that voting on this bill is voting on whether or not a person in the Commonwealth should be punished for refusing to receive the experimental COVID vaccination. Thank you.
Wow. Okay. Are there any questions for the patron? Delegate Price, I see you have your hand up.
Yes, thank you, Mr. Chairman. Before we could even get to the content of the bill, I would just like to speak into the bill, Mr. Chairman.
Gentlewoman has the floor.
This is such an important time that false information is just simply dangerous. There is legitimate vaccine hesitancy in communities that the gentleman listed, but actual and factual information is key, not fanning the flames that are based on historic events. In essence, to not talk about the research that has been going on for decades for viruses that are very similar to COVID-19, to not talk about the parts of the process that were cut short, were bureaucratic red tape, not the actual experimental clinical trials on humans. To not talk about that and to give it proper context is just simply dangerous. And so I don't have time to fact check the entire gentleman's presentation, but I would just like to put that on the record that I do not associate myself with any of the comments that were made. And I do have a motion at the appropriate time.
Okay. Any other comments on Delegate Hope has his hand up?
Well, I just want to follow up on my colleague, Delegate Price. I just made very clear to the public, for Virginians I know is watching this, the FDA has authorized this different drugs for emergency use. And to make that crystal clear that these are safe and effective vaccines that have been approved under the FDA's emergency use authorization. So I just want to make that crystal clear that this COVID vaccine is safe and effective. And I think Ms. Delegate Price, I yield to her for motion.
Okay. Does anybody else have a question before we yield to Delegate Price? Okay, Delegate Price.
I move that
Mr. Chairman. Mr. Chairman, are you going to invite testimony on the bill?
Madam Clerk, how many witnesses do we have?
Mr. Chair, we have 2 people signed up that are present, I should say.
Okay. Okay. Yeah, if we could, 30 seconds apiece would be good. We heard another kind of similar vaccine bill earlier tonight. Please bring them in the room, Madam Clerk. Thank you.
Yes, Mr. Chair. Our first speaker is Josh Hetzler.
Okay. Yeah. Thank you. Yes.
Josh Hetzler with
Welcome
the Family.
back.
Thank you. I just want to add a quick comment that the emergency use authorization is far from the full authorization from the FDA. We don't know a lot about this since it was done so quickly. And also, we don't have decades worth of research on this. This is a type of vaccine that has never been used before. It's a unique mRNA vaccine. There are many things we don't know. And that's really one of the big reasons why we shouldn't discriminate against people who don't want to take this, because there are many unknowns and we need to be able to make fully informed consent. So,
look, I just interject a second. No one's going to discriminate against you if you don't take this vaccine. I just want to make that clear. We don't have enough vaccine for the people who want it. So,
just to make sure, you should pass this bill.
We don't, most of the time Republicans don't want us to put extra words in the code that are not necessary. The next speaker, please.
Mr. Chair, our final speaker is Jay Deck. Jay.
Welcome, Mr. Dick.
Thank you, Jay Deck with the Virginia Education Association. This pandemic is unique, and we need to do everything we can do to try to save lives and not play into hysteria and false accusations. So, therefore, we are against this bill. Thank you, Mr. Chair.
Okay. Thank you. I see 2 hands up. Delegate Levine was up first again, and Delegate Price was about to make a motion, Delegate Levine, but go ahead.
Mr. Chairman, if we had not had vaccines for polio and smallpox, imagine the damage that could have been done. This is a terrible bill. Thank you.
Delegate Hope.
Mr. Chairman, may I have the last word?
No. Delegate Hope.
Mr. Chairman, I move to
807. Yeah.
Second.
I moved. Yeah.
Okay, it's been moved and seconded that we lay the bill 2242 on the table.
On the table.
Okay, let's everybody vote here. Delegate Rasool, Delegate Price. Okay, clerk, please close the roll. And the motion to lay the bill on the table passes on a vote of 18-3. Thank you very much.